Hi, I'm Nolan Baker, co-owner of America's Retirement Headquarters, here with another part of our great debate series. And at America's Retirement Headquarters, we tried to build it as one location to have everything taken care of for people that are close to or in retirement time. So within the building, we have various divisions to be able to help with better managing your money, protecting your assets, and efficiently planning your estate. Today I'm joined with Scott Kerschner, who runs America's Medicare Associates, and today we're going to talk a little bit about some of the topics that are a big concern for people. They're health insurance, Medicare, and really trying to get a better understanding. So Scott, what I've done is I've taken some of the most common questions that we get when we talk with people that are close to or in retirement time, and I thought we'd maybe debate those.
Sure.
So I think one of the first questions I'll go with is talking about going with original Medicare, or do you do a supplemental plan? What would you say to that?
Well, it's a great question, Nolan, and thank you for that question. So original Medicare has several pitfalls. For example, Part A hospitalization, you're going to have a $1,408 out-of-pocket expense in a hospital stay. In Medicare Part B, you have a deductible of $198. So with a supplemental plan, you can cover those out-of-pocket expenses. They also have Advantage plans that cover some of those out-of-pocket expenses as well as other coverages. So if you choose to just go with Medicare and not purchase a supplement, you've got an exposure for significant out-of-pocket expenses. Another thing to be aware of is Medicare Part B without a supplement is an 80-20 plan. So you would be responsible for 20% of the total cost of the care. So that's one reason why most people purchase a Medicare supplement or an Advantage plan.
So good question. Obviously a very deep topic when you're looking at your individual situation on what decisions to make with your individual coverage. Of course, Scott has some longer versions if you'd like to learn more on this topic. You can visit us on YouTube at America's Retirement Headquarters, and our YouTube channel has some in-depth videos on this particular topic. But Scott, I guess the next question as we talk about our great debate today is a lot of Americans are working longer.
Sure.
It's not common for people to, just continue working past what would be considered normal retirement age. And I guess it's a confusing topic, and maybe a topic I'm quite frankly a little confused on. So, when you turn 65, you think normally Medicare, but what happens in a situation when somebody decides to work past age 65? What's the difference with their employer health insurance versus Medicare?
Well, Nolan, that is a big topic of discussion today. People are working into their mid or to late 60s, and one of the big questions they have is, if I have employer-sponsored health care, should I take that or sign up for Medicare? And that's a very difficult question to answer. There's no right answer, to be honest with you, but there are several different things that take into consideration. One, a lot of times the employer may pay for the health insurance. And if that's the case, then what we do, and what I do, is I go through and evaluate what your cost for health care is and your out-of-pocket expense. A lot of employer plans today have a very high deductible. You may have a $5,000 deductible and then an additional 20% out of pocket. With Medicare, you're going to have an expense for your Part B premium, your supplemental policy or Advantage plan, and then prescriptions if you go with a supplement. So what I do is I'll sit down with the client and I'll evaluate what the employer plan is going to cost and what the benefits and the employer or the Medicare plan would cost. A lot of times it's a much better advantage to go with the supplemental policy, drop the employer plan, and have less out of pocket. But that's a great question, and with the economy, sometimes people decide to retire at 67, 68, 69 years old. So great question, and it's a big issue today.
Awesome, thanks, Scott. And I'd say, as we're rounding out our great debate questions today, and we could debate health insurance all day long, and obviously everybody's situation's a little bit unique. Obviously, Scott would be more than happy to talk to you about your particular situation and share some ideas. But the third question that I get, which is kind of common, is talking about prescription drugs and whether you should get coverage or not. You know, I know being a younger guy, being self-employed, I've had to purchase my own health insurance on the open market. I can remember when my oldest son was quite a bit younger, and we had to get some medication for him one time. And this medication, it was $100 per thing that he had to swallow. And the first time we gave it to him, he took and he spit it back out on the kitchen floor. And I was just like, oh my goodness, right? At the same time, there's great deals that can be found on prescription drugs, whether it's getting your cholesterol medication through Myers and figuring out and navigating those things. So it is another debatable question. The question is getting prescription drug coverage or no coverage. What would you say to that?
Well, if a person is turning 65 and signs up for Medicare, they're required to sign up for Part D, which is your prescription. If you choose not to sign up for prescriptions, in fact, just the other day I spoke with a client and they have a brother who chose not to sign up for it. They pay a 1% penalty on the national average of the premium for the prescription card for the number of months that they did not sign up. That could be a big number. And it's always, regardless of whether you're taking any medications once you turn 65, you definitely want to sign up for some sort of prescription card. Some other options, and like you said, your son spit up a $100 bill on the table there. That's sometimes a tough pill to swallow, so to speak. But there are also companies out there that offer discounts. In addition to a drug card, you can also get a discount card. So you want to be a smart consumer and shop, because each pharmacy has a different cost. The drugs are different prices through all of the different pharmacies. And you just want to be a smart shopper and do your homework and see what plans are available out there.
And I think one of the advantages, again, working with America's Medicare Associates is Scott's local, a guy that you can pick up the phone and talk about your individual situation, not get to run around on an 800 number and have to tell your story over and over again, but have somebody as an advocate for you, looking at your plans, helping you make a smart, educated decision about what's the right choice for you and your family. Scott, if people wanted to find out more, what would be the different ways to get a hold of you?
Well, there are several different ways. Obviously, a phone call. My number is 419-794-3053. You can visit my website. It's americasmedicareassociates.com. I am also on LinkedIn and Facebook, America's Medicare Associates. You do a search on that, you're going to find me.
Good. Easy way to get a hold of them. Again, Scott Kerschner here with America's Medicare Associates. I'm Nolan Baker from America's Retirement Headquarters, and you've listened to today on the great debate for health insurance and Medicare. So thanks so much for tuning in and joining us today. We hope you have a wonderful day.